Welcome back. June is Pride Month, a month to celebrate diversity and promote equality in the LGBTQ community. Mental health struggles can be a big issue for the LGBTQ people. And this afternoon, Dr. Douglas Knutson is here to talk about his work to help support people in the LGBTQ community and why it's important for everyone to celebrate Pride Month. So thank you so much for coming today. Let's start with the main mental health issues that folks face.
Absolutely. So depression and anxiety are very elevated in LGBTQ plus communities more generally, mostly as the result of discrimination that's experienced in that community. There are large surveys that identify a lot of sociocultural variables and just basic needs that aren't met for LGBTQ plus communities, but a lot of the distress and the unmet needs express themselves as anxiety and depression for this community.
And so how did you come across this? Did you start by figuring out how to support folks in the LGBTQ community, or how did you get started and involved?
Well, I went to Oklahoma State University's doctoral program in counseling psychology and had the benefit of working with Julie Cook, who was my advisor at that time and gave me the opportunity to begin engaging particularly with trans and non-binary affirmative care. And that's where I found my heart for the LGBTQ plus community, got opportunities to have experience and to begin conducting research in affirmative care, and then it just took off from there. So now I'm there at the university and get to have my own doctoral students doing similar work, identifying ways to support and to encourage LGBTQ plus folks in the local communities here in Oklahoma and beyond.
I love that. And then what are some of the ways that folks can support them here in the local community?
Absolutely. A lot of the ways you can support folks is by getting clear about who you are. There are identified ways of supporting people, like connecting them with community and providing appropriate medical services and whatnot. But just as people, the more in touch we get with our own gender identities, our own sexual orientations, who we are as people, the more we're able to support other people and to be okay with who they are as well. And so a lot of the work that I do in affirmative care just encourages therapists, providers, community members to figure out who they are and to get in touch with themselves so that they can find a place of compassion and love to reach out to others like LGBTQ plus folks.
That's great. And you kind of touched on it too, why it is so important for everyone to celebrate Pride Month. And so how do you think we could do better with that, celebrating and acknowledging Pride Month?
Absolutely. Well, I think it's important in any conversation like this to acknowledge that there is nothing wrong or disordered or sick about being LGBTQ+. The distress and anxiety are coming from rejection and pain from other people. And that means LGBTQ+ resilience and care is the job of all of us, because when we don't love and care for others, we contribute to that anxiety and depression that without us would not be there in the first place in many respects. So pride and support and love and affirming our LGBTQ plus people in our communities is all of our jobs. And it starts with that awareness and that care for ourselves that allows us to then care for others.
Well, thank you so much for coming today, and thank you for all of your hard work. We appreciate it so much. So we'll be right back after this break.